Green tea has long been celebrated for its health benefits. Its polyphenol, especially EGCG, epigallocatechin gallate, are widely promoted for their antioxidant, anti-inflammatory, and fat-burning properties. But behind the marketing gloss lies a serious and growing body of evidence that high doses of EGCG, particularly in supplement form, can be toxic, especially to the liver. And the damage is often sudden, severe, and, in some cases, irreversible. While drinking traditional brewed green tea in moderate amounts, 2 to 3 cups per day, is generally considered safe and possibly even protective, the concentrated extracts used in supplements are an entirely different story. EGCG, the most abundant and biologically active catechin in green tea, can disrupt cellular function when taken in excessive doses. Research now confirms that doses exceeding 800 milligrams per day of EGCG can cause liver damage, ranging from elevated liver enzymes to acute hepatitis and even full-blown liver failure. Some patients have required hospitalization. Others have undergone liver transplants. And some, tragically, have died. The mechanism is disturbing. At high concentrations, EGCG acts not as an antioxidant, but as a pro-oxidant, triggering oxidative stress within liver cells. Mitochondrial dysfunction, inflammation, and apoptosis, programmed cell death, follow. This paradox, where a compound known for reducing oxidative stress starts inducing it, is not just theoretical. It's been observed in lab studies, animal models, and real-world clinical cases. EGCG is dose-dependent in its effects. Small amounts may support cellular health, but large doses act more like a toxic drug than a healing agent. The problem becomes especially dangerous because of how these supplements are consumed. Many people taking green tea extract for weight loss or detoxification are already under physical stress, fasting, overexercising, or following restrictive diets. These conditions reduce the liver's resilience and increase vulnerability to toxins. Combine that with 2 or 3 capsules of green tea extract per day, each potentially containing 300 to 500 milligrams of EGCG, and you've created a perfect storm. Several case reports have linked green tea extract supplements directly to hepatotoxicity. Symptoms often begin subtly: fatigue, nausea, dark urine, or upper abdominal pain. But without immediate intervention, liver damage can progress quickly. In a 2020 review, researchers identified green tea extract as one of the top culprits in supplement-induced liver injury across multiple continents. Regulatory bodies like the European Food Safety Authority, EFSA, have since issued warnings, stating that EGCG doses over 800 milligrams per day pose clear health risks and that even lower doses may be dangerous in fasting individuals or when taken on an empty stomach. Compounding the risk is the fact that most supplements do not accurately label their EGCG content. A product may say green tea extract, but fail to disclose the specific amount of catechins or EGCG it contains. This makes dose control nearly impossible for consumers. Some formulations even blend green tea with other stimulants like caffeine or synephrine, creating additional liver and cardiovascular strain. The danger is not just the extract itself, but the way it's delivered, without oversight, without clinical guidance, and often in the context of other risky lifestyle habits. It's important to recognize that antioxidant is not a synonym for safe. High-dose EGCG supplements are not the same as a cup of green tea. When removed from their natural context and concentrated into capsules, even plant-derived compounds can become pharmacologically active, unpredictable, and harmful. And while supplement companies highlight vague promises of fat burning and detox, they are not required to test for liver safety, nor do they face the same regulatory scrutiny as pharmaceutical drugs. For individuals considering green tea extract as a health booster, the warnings are clear. Avoid supplements that do not list EGCG content precisely. Do not exceed 300 to 400 milligrams of EGCG per day from supplements. Never take green tea extract on an empty stomach or during a fast. Discontinue use immediately if you notice fatigue, jaundice, or abdominal discomfort. Avoid stacking green tea extract with other liver-impacting drugs or supplements. Speak to a healthcare provider before using any high-dose green tea product, especially if you have any history of liver disease, alcohol use, or medication use. The irony is that people often take these supplements in the name of improving health, yet they may be actively undermining it. A flat belly or a slight increase in metabolism is not worth a damaged liver. Real health doesn't come in capsule form, and there is no shortcut that makes it safe to overload your system with biologically active compounds simply because they are natural. The public needs to move beyond the marketing myth that equates plants with safety. Green tea is a healthy beverage. EGSG is a powerful molecule, but like any powerful compound, it must be respected. When misused or overused, even the most celebrated natural substances can do serious harm. And in the case of EGCG, the line between therapeutic and toxic is thin and often invisible until it's too late.